Hey everybody, it's Kelli Hiller again, Professor of Clinical Laboratory Science here at Bristol. So today I wanted to talk to you a little bit about what if you have to get a test collected for COVID-19 and where does it go afterwards. This is something that's a mystery to a lot of people, and maybe you've had some experience with some tests, but not necessarily this specific test. So most of you throughout your childhood probably had a throat swab done. So this is a typical swab that you would see for a throat swab, larger of size, and it's going to go in your throat. For the COVID-19, they are collecting a nasopharyngeal swab. So it looks a little different, and I'm going to hold them side by side. You can see it's very small and it's flexible. And these are very stiff. We just go in, swab, and get it out. So for these, what you're actually going to have collected is it's going to go through the nostril, and the provider, the healthcare provider, is going to collect this. They will look a little scary because they're going to be in full PPE, so personal protective equipment. So they'll have gowns, gloves, masks, and face shields at this point. And you'll either be getting them collected at different types of collection sites. Some places have drive-in collection sites, some places where you actually have to schedule appointments, things like that. When the time comes to collect the swab, the provider will have you tilt your nose back. I'm obviously not going to do this to myself because that's very difficult. And basically it's going to go in your nostril, and it's going to go all the way back to the back of the nostril. So the swab will probably be in about this far. It doesn't necessarily hurt. It's very uncomfortable, and they may do one or both nares or nostrils, and your eyes are going to water. Don't worry, we all do. Once that's done, what they're actually going to do is, normally you'd see it be put into, if you're getting a throat swab, you'd see it put into a container like this, and this just kind of keeps it ready to be able to get cultured or tested in the lab. We're not culturing for COVID-19 because it's a virus, and the viral cultures take a very long time to do. So they're going to put it in something that looks like this with a little bit of nutrient media, and that's going to be able to allow them to transport to the lab. So once they collect it and label it properly with your name, date of birth, and medical record number if you have one, they're going to send it off to a testing site. Now, the collection sites are not necessarily the same thing as a testing site. Some places have both, but most they're going to collect and they're going to send these. These are tests that we can't necessarily do in routine hospital labs. So they're going to send them out to places like Quest Diagnostics, for example, and some of our local hospitals have some testing capabilities as well. So what does that mean? So the test itself is actually looking for the RNA of the virus, similar to what's called an RT-PCR, and this is where they're going to actually look at the virus structure itself, isolate that RNA, and then they're able to amplify it to be able to detect to see if it is present within your nostrils or your nasopharyngeal area. There are other tests that can be done. We're not necessarily doing them now, but right now the most common test for COVID-19 is done with a nasopharyngeal swab in a reference lab in molecular testing. So that would be someone like myself performing that test behind the scenes. And once we go through that whole process, your provider will get your test results, and you'll either get your negative or positive for COVID-19. So the testing process and the collecting process is really not scary, and it's very simple, very quick and easy, and just a little bit uncomfortable. And it does smell, because you're getting it so far up in there, it does smell a little bit. So hopefully that gave you a little bit of knowledge on what we do behind the scenes for COVID-19 testing.